What diagnostic tools are most commonly used for migraine assessment? Have you ever wondered how doctors figure out if someone has migraines? Understanding the diagnostic tools used for migraine assessment can be quite fascinating. Let's break it down in simple terms. The first step in diagnosing migraines is a clinical evaluation. This involves a detailed medical history where the doctor asks about your headaches. They want to know how long your headaches last, how intense they are, where the pain is located, and if you experience any other symptoms like nausea or sensitivity to light and sound. This information helps distinguish migraines from other types of headaches. Next, many patients keep headache diaries. These diaries are a great way to track your headaches. You can note how often they occur, how long they last, and any symptoms you experience. This objective data is helpful for both you and your doctor. Some people prefer using headache calendars, which are simpler and just track the frequency and intensity of headaches over time. Another useful tool is validated screening questionnaires. These self-report tools help identify migraines and their subtypes. For example, the ID Migraine questionnaire asks 3 simple questions about disability, nausea, and light sensitivity. It is effective in identifying migraines. Other questionnaires, like the Migraine Assessment tool and the Asian Migraine Criteria, provide more detailed assessments. A neurological examination is also part of the process. During this exam, the doctor checks your mental status, motor strength, vision, reflexes, and cranial nerve function. This helps rule out other neurological conditions that might mimic migraines, such as brain tumors or blood clots. Imaging studies, like magnetic resonance imaging or computed tomography scans, are not usually needed for every migraine case. However, they may be used if the diagnosis is unclear or if there are unusual or severe symptoms. These imaging tests provide detailed pictures of the brain, helping to rule out any serious issues. Finally, the International Classification of Headache Disorders provides standardized criteria for diagnosing migraines. This classification helps doctors determine if a patient has migraines with or without aura based on specific symptoms and their frequency. In practical terms, diagnosing migraines starts with gathering a thorough patient history and evaluating symptoms. Headache diaries and screening questionnaires support this process. Neurological exams and imaging studies are reserved for cases where other causes need to be ruled out. This systematic approach ensures that patients receive accurate diagnoses and effective treatment plans.